eclectic Augusta Avenue and Kensington Market is home to one of 5 safe consumption sites in Toronto that is being forced to close by next March because they're within 200 meters of a school or childcare center.
The sites are where they need to be. They're where the community has need.
The Reverend at this nearby church is connected with several clients who use the service.
First of all, it has saved the lives of a lot of people, and that's the number one thing that it's there to do. It's also a space where people can connect to mental health treatment, where they can connect to addictions counseling and recovery resources.
The safe consumption sites are allowed to apply to become a homelessness and addiction recovery treatment hub, but will no longer be able to offer supervised injections, safe drug supply, or needle exchange.
People are going to die. People are going to die. We're going to see more public drug consumption. We're going to see people getting infected with HIV and hepatitis C at a time when rates have actually leveled off in this country. But we're going to see rates go back up because when you don't replace these needle and syringe programs, what do we have? We have treatment and hubs that you can actually do harm reduction work.
The province is investing over $370 million into these new treatment hubs, but health professionals say that's only part of the solution.
It's no secret that this government really has a preference for treatment over harm reduction, and that's something I think we were aware of for some time. We know what we would like to see is the continuum, right? So we recognize not everybody's ready, as I said, and we can pull people in through harm reduction and then through to treatment.
We actually agree with the announcement in that, the lack of focus on treatment in supervised consumption sites can leave people trapped in the horrors of active addiction.
What's your substance of choice?
Some in the treatment space have mixed feelings and say safe consumption sites were part of keeping people alive long enough to eventually live without drugs.
We have clients in our live-in treatment programs as well as in our virtual programs who their life has been saved by the continuum of harm reduction services. We've had people who were regulars of supervised consumption sites who eventually were able to get to treatment, and they would not be with us if it wasn't for those sites.
Manucdoc, CBC News, Toronto.